Each Tuesday, we welcome Dr. Steve Turkovich, president of Oishei Children's Hospital, here for Ask the Pediatrician. Dr. Turkovich, always good to see you.
You too.
So the more we do this segment, the more questions come in. So if you have one, please email or go on Facebook, leave us a message. It's easy to do that. We're going to get through a few of them today. Our first one here actually comes from Tom, and I think there's a lot of confusion about CBD products. He's asking, are they safe for teenagers, specifically dealing with anxiety? There are lots of products out there.
Oh yeah, and I have to say mental health issues in teenagers in particular have gone through the roof during COVID and the post-pandemic. So we're very sensitive to the needs of teenagers. The one thing I do to help parents is that there are not many studies about CBD in children. So we have to be very careful with that. The teenage brain continues to grow and develop until you're about 26 years old. So products like this can have some pretty significant impact on your brain. And if you're concerned about anxiety or depression, the best thing to do would be to talk to your pediatrician and get hooked up with a counselor or psychiatrist to make sure that you actually make the diagnosis and confirm that you do have anxiety. And then when you're treating mental health, you want to sometimes combine that with therapies, counseling, and things like that. It's not just a medication that you need. So I tell parents, don't jump to a medication or some sort of substance like that, because really the best thing to do is understand the diagnosis, make sure you get the most robust holistic treatment with counseling and potentially a medication that's been studied, and then also work through some of the issues that could be potentially causing the anxiety and work through those.
All right, Michelle asked us, what is the best way to relieve constipation in a 5-year-old? A specific question, but one that every parent has dealt with at some point.
So I see lots of constipation in the hospital and the emergency room and pediatricians' offices. So constipation is very challenging. And I think one of the things you want to do is make the stool nice and soft. And so you could do that through things like Miralax, which is a fiber sort of medication that you mix in with fluid. And you want to get them on a regular schedule. So get them on the toilet regularly after you're eating. Make sure the stool remains nice and soft by using their Miralax. Sometimes there's anxiety associated with going to the bathroom, and so you want to manage that with positive reinforcement, encourage them, and if there's real significant backup, then you may need to go to your pediatrician and help get things moving with some more aggressive treatment.
Finally, I have about 30 seconds left, but I love this question. What tip would you give people trying to break serious pacifier dependence in a 2.5-year-old? This coming from Kelly.
Great question. There's a couple of things. Number one, there's a cold turkey. You could say, you know what, the pacifier fairy took it, it's gone, and that's it. But I usually want to make it sort of a positive thing. So you can engage them, you could do positive reinforcement and say, if you don't use it today, you get a little sticker or a gift or a piece of candy, and you sort of do a sticker chart that way. Or you have a ceremony. And you say, you're a big kid now, we're saying goodbye to it, it's very positive, make a party out of it.
Good stuff as always, Dr. Turkovich. Great to see you. Thank you.
You too. Thank you.